Bullying, social media, post-pandemic fallout, violence, and so much more. Our youth, they're dealing with concerns on a whole different level than other generations, and it's taking a toll on them.
Fox 6's Derica Williams shares how they're helping school us on why it's crucial to keep mental health at the forefront.
Navigating an academic journey, while some lessons are felt like they're being learned alone.
I feel like it's really a struggle right now.
12th grader Mary Gruber is familiar with many of the teenage challenges.
The pressure to take all these academically rigorous courses and then be in so many different clubs and so many different sports and still have a job and spend time with your friends and family. I feel like it's a lot, and everything's getting so much more competitive.
To help even the playing field mentally for other youth, Gruber is a leader in the program Peers for Peers at Waukesha West High School.
And they're trained in active listening skills.
School social worker Catherine Callahan says the mentorship helps students educate and encourage.
They understand how they can be a support for other students in the building. And they also focus on things like leading a healthy lifestyle without alcohol, drugs, or vaping.
Stressors and triggers have been exacerbated by the pandemic, but have really been an underlying issue for some time.
From 2017 to 2021, when you look at the youth risk assessment, anxiety increased 12%. So our students are feeling more overwhelmed. And so I think for staff, we need to be more engaged and just more aware of how can we help.
Placing a source of hope and support right at their fingertips.
I'm confident that some of our kids who are in need are using it.
988, the Suicide and Crisis Lifeline, is printed on the back of school IDs.
We want to make sure that they know it is available to them 24 hours a day. And we have the 988 signs in all of the classrooms as well.
Visuals to help connect what's going on internally.
The state of children right now is a very troubling one. The levels of anxiety and depression that our kids are experiencing are very difficult.
But Linda Hall, director of the Wisconsin Office of Children's Mental Health, says there is hope on the horizon.
Actually shows a decrease in suicide for youth from age 10 to 24.
An encouraging stat as resources and destigmatization continue to play a huge role.
We have identified over 200 schools in Wisconsin that have a youth-led mental health program.
Whether it's being an outlet for a peer,
and she was getting messages from one of her friends talking about self-harm and just that she was threatening it,
or intervening with the appropriate channel.
We contacted her family so we could get someone to help her right away.
It seems students play a major part in the success of mental wellness.
It's just nice to help people.
Crucial, especially for certain demographics of Wisconsin's youth. Female students are more than twice as likely to report seriously considering suicide and twice as likely to actually attempt it. Almost half of LGBTQ students reported seriously considering suicide. That's 4 times as high as their peers.
Also alarming are students who are food insecure. 41% indicated that they were considering suicide. And then our Asian and Hispanic Latino population also reported 20%.
So about an 8 session.
And the work happening within these 4 walls.
Well, our Black youth are going through a lot.
Addressing rates among African Americans.
Speaking about Black youth and suicide.
In partnership with Milwaukee Public Schools, the first Black Youth Suicide Prevention Summit was held. Keynote speaker Dr. Leah Knox, who is a mental wellness expert and licensed professional counselor, explains the epidemic within the culture.
Since 2003 all the way into 2021, there has been a 144% increase within our Black youth and suicide between the ages of 10 and 19 years old.
The gathering brought educators, parents, therapists, counselors, social and healthcare workers together.
My main goal is a call to action. What can we do as a community?
From sharing suicide prevention and intervention skills to emotional and financial resources available for youth who are struggling.
We want to build a culture that people are cared for.
From those on the outside to the students in the midst of it all.
In the health classes that every freshman has to take, they go through the SOS, Signs of Suicide program.
The stigma is being erased and issues are colored with care.
And they learn how to intervene when they're concerned about a friend or a loved one, what signs to look for, how they can be that bridge to getting that person to an adult, or just start to build that team around them.
Helping see the signs and give direction.
It is okay to need to talk to somebody.
Creating a culture of safe space, healing, and resilience.
No, we got you.
Callahan says it seems the 988 number is averaging about 5,900 contacts a month, which is a positive and life-saving statistic, showing there is a value and importance to it. Whether it's connection to telehealth, a social worker, a physical site, support group, or even pediatricians, there's help to address the challenges kids are facing. DHS has an extensive site for youth mental health to help you map out the care you need. We've posted that on our website, fox6now.com. Derica Williams, Fox 6 News.